Health Employment Network. Some of you may already know me. I've been in contact with some, and some of you, might be your first time. So today, I'm going to do an information session about our program to explain what is our program, what we do, and how we do it. Okay. So our program called the Health Employment Network, it used to be called the Career Transition for International Health Trained Professionals, and now it's called Health Employment Network. So our program is an Ontario Bridge training program. And what does a bridge program means? It's a program designed to bridge the gap between someone who just arrived in Canada or someone who just immigrated to Canada and the Canadian knowledge and the Canadian education or the Canadian industry. So basically, the bridging program, the main thing is to break the gap when it comes to the barrier that happen. For example, in case of international health trained professionals, those barriers could be something like high cost of licensing and skill upgrading. We all know that if you want to be a license in Canada, you would go through a licensing process, which might take a long time, and it's a very long process. However, some people will still want to seek employment while doing that. So this is one of the targets of the bridging program. Number two is the limited knowledge of the Canadian labor market. So again, is to provide the knowledge of the Canadian labor market and the Canadian industry. And then number three, one of the barriers also is lack of Canadian experience and professional network, and few bridging program available. So mainly what we do is we try to bridge the gap by bringing knowledge and Canadian labor market to our clients. So what we do, our approach is, it's a design to bring the gap and support you to find employment in Canada while supporting your long-term career journey. So someone could be, for example, aiming to be a licensed pharmacist or a licensed physician. So we help you to find employment while doing that, and we also support with licensing process itself. So the Health Employment Network program is a partnership program between two organizations, World Skills Employment Center, which is an organization for employment, and the Catholic Center for Immigrants, which is a settlement organization. So the partnership between those two organizations allow us to provide both employment services and settlement services. So we all know that finding job is not just about finding employment. Some people may be having other challenges, such as daycare, such as housing, such as a lot of things. So bringing those two services together help us to put our clients in the best way or the best services for them to find employment, or to provide the best support for them to find employment. We serve clients all over Ontario. Although World Skills and Catholic Center for Immigrants are located in Ottawa or based in Ottawa, our program is Ontario-wide program, so we serve all clients Ontario-wide. It's tailored for internationally trained health professionals, doctors, nurses, researchers, laboratory technicians, pharmacists. We're going to go into that more when we talk about the eligibility criteria. We assist with transition into unregulated jobs. So basically what we do is we try to help our clients find an unregulated job. So say a pharmacist, something like a pharmacy assistant, say some physician, something like a medical assistant, and so on. It will be an unregulated field. And we support with navigating licensing as well, and second career options. And our program is fully delivered virtually. That's why we are able to serve Ontario-wide. So how can we help? Our program mainly have three parts to it. First part is the cohort workshop. The second is the employment counseling. The third is the employer engagement. So the cohort workshop. So this part is a mandatory part and is the first step from the program. Once that someone become our client, they are mandated and compulsory to attend workshop. This workshop are delivered over 3 weeks for 3 hours, Monday to Friday, 3 hours in the morning, 9:30 to 12:30. So basically what we cover during this workshop is extensive knowledge of the Canadian health system, the Canadian health industries, what are the updates, what is happening, the workplace communication, and transferable skills, and how to put together a resume and cover letter, and also how to expand your network, because there will be other people with you in the cohort, and you can consider them your first network. And then after you finish with the 3 weeks, you will be assigned an employment specialist, and the person will work with you one-on-one to provide employment counseling. So it's a one-on-one session with your employment counselor. For example, one of our employment counselors is with us today, Rashid. And then they provide action plan, job readiness, review your resume and cover letter, mock interview if you have an upcoming interview. We have career path and career transition. Say, for example, you consider transition into another career, and we have another referral and resources. The last part is employer engagement. Once you pass through you finish with the workshop, and then you meet your employment specialist, then there will be a part of employer engagement. So basically, you will provide personalized support to move forward. There will be employer partnership. So we have partnership with some employers. So the basic point is to connect you with this employer if their requirement fit your skills. So there will be something like targeted recruitment events that you will be invited to, weekly job updates or weekly job newsletter that you will receive. And then there will be another part, which is endorsement. So endorsement, basically, if we have an employer that we are partnered with and they have a position open, so, and you fit one of those skills and then you apply, then that gives us a chance to highlight your resume with that employer, which might increase your chance of getting an interview. However, we cannot control the result of that interview. Okay. So basically what I say is we an employment support, not an employment placement, which means basically we try to support you to give you connection, referrals, resources, the best one, and guidance for you to find employment. However, we cannot guarantee a placement. Okay. So how can someone become a client of ours? So we have an eligibility criteria that the person must fit into. Number one, they have to be a resident of Ontario. And so when you would have to you have to provide a proof of residence. You have to be an internationally educated health professional, a nurse, a pharmacist, medical lab, research, someone, for example, a health science with a public health, master in public health, and so on. However, at the moment, we are unable to support dentists, veterinarians, and specialized medical doctors, such as OBGYN or pediatrician and any specialized medical doctor. However, family physicians are accepted. Okay. You need to have a minimum of 2 years of work experience in your field outside Canada. And your immigration status can be a Canadian permanent resident or a naturalized Canadian, but you have to be here less than 5 years. You can be a conventional refugee, a refugee claimant with a valid 1 to 2 years work permit. So your work permit has to be valid for at least 1 year from the day you will start the cohort or the day you apply to the program. Last but not least, we have an English assessment requirement. So you will have to have an English level of a CLB 7 or higher, or an equivalent of that, for example, IELTS or TOEFL or TOEIC or anything else. So basically, I know some people come from places that they have studied English in, like the whole study was in English, the whole university was in English and everything. So we still require you to do the English assessment. Okay. So the Health Employment Network requires effort. For example, the 3 weeks training is an intensive program, actually, because there will be some homeworks, there will be some assignments that you will need to submit. So it's actually a very intense program. So it requires effort, commitment, and patience. And we provide the tools, resources, and opportunities. And you will need to stay open, stay curious, and have a curious mindset to grow. So, for example, you can take me. I am originally an internationally trained pharmacist, but during my transition, I have some public health or some social service experience. I used to be a client of the Health Employment Network myself, and now I work in one of the employment center or in the settlement center, because one of my skills is the community service part, which helped me to guarantee this job. So this is one of the unregulated jobs that we can help you find. So it all depends on your set of skills and what is your goals. So the career samples can be medical office assistant, medical administration, medical interpreter, public health roles, personal support worker or personal support aide, clinical research roles, so clinical assistant roles, or nurse assistant or nurse aide. So to register for the program, I will put the link in the chat, and I will also put my contact number for you to feel free to reach out. As I mentioned, some of you are already in contact with me, so that's fine. If you're not, then I would highly encourage you to apply. So what are our upcoming cohorts? So basically, that's something I can go back to. We have two cohorts. We have English cohort, which means all the services are English, and we have a French pathway or a French cohort, which means most of the services or the majority of the services, especially the 3 weeks training, is in French. So our upcoming cohort is a French cohort, and it's going to be in June 15th. For our English cohort, that's going to be until September. Okay. So does anyone has any question?
I'm sorry, I didn't get the English cohort. You said it's starting what month, please?
September.
Okay, thank you.
Yes, because usually July and August, it's summer. People are out enjoying, kids are home, people are traveling, have plans. So usually July and August, we don't have cohorts in July and August. Okay, does anyone have any other question?
Hello, yes. Are these as well applicable for clinical psychologists?
Can you repeat that?
Are like whatever you mentioned are applicable for clinical psychologists?
Yes.
Okay, thank you.
You're welcome.
Sorry, said one of the requirements that we should be a CLP 7 or more, right?
Yes.
Okay, and is it like an obligatory requirement, or if we have, for example, experience in our country, is it counted or not?
So experience in your country is a requirement itself. So you will need to have 2 years of experience in your country or 2 years of experience outside Canada. And then addition to that, you need to have the English assessment or the English level of 7 or higher.
Yeah, so it's for English, it's 7. If you would like to attend the English cohort, you need to have CLB 7. If you are a Francophone or you speak French and you are very strong in French, so at that time, your CLB 5 is enough. So because you will attend the workshops in French and not in English.
Okay, you mean if I'm a bilingual, I have more chances to get that, right?
Yes.
Yeah, sure, that's right. Okay. If you are bilingual, means that like more Francophone than English speaker. At that time, you can apply for French cohort, and all what you need to provide is CLB 5.
Yeah, I got it. Okay, thank you.
But you will get, I would say that you will attend the workshops in French, but the rest of the services, I would say, like apart from the action plan, the rest is in English, like with the cover letter and the counseling in general, it's in English.
Yeah.
Excuse me. I want to know that if medical radiation technologies can benefit from this program, please.
Medical radiation technologists?
Yes.
So medical radiation technologies, it depends on your, which country did you and how many
from
years?
Morocco. 14 years of experience.
Okay. And are you aiming to be a medical radiologist technologist here in Canada?
Yes.
Okay. So because I know the licensing process for medical technologies is a bit complicated. And in this case, it depends on the roles and unregulated roles that you're open to.
Yes.
So in that case, just reach out to me directly through my email, and then we can go through all the details and see what are the options that we have.
Okay, thank you so much.
You're welcome.
I have a question. Good morning, all. I'm a registered nurse, and I'm already registered with the College of Nurses of Ontario already. So do I have still qualified with this?
Yes, you do.
Thank you.
Yes.
I have a question.
Yeah.
Yeah, I come from Taiwan. I have over 10 years background in life science and medical device industry, and progressing from R&D engineer and regulatory reviewer to product manager. So I am currently targeting unregulated PM roles such as clinical trial program manager in research institute. The HEM program has connection with life science company, research institute, or NGO that regularly hire for these specific technical managers roles.
So for the research part, one of the employers that we have connection with at the moment is OHRI, which is the Ottawa Health Research Institute. So that is considered one of our connection. So as I mentioned, research is one of the field that we highly encourage people, if they have that background, to apply to. So if you have a research background and you want to go into the clinical research, then we do have that connection.
Okay, but if I suitable to join the HEM program, like
can you?
I mean, like our background is it suitable to join the HEM program?
Yeah, as long as you meet all the other requirements, like more than 2 years experience, less than 5 years in Canada, and the English assessment and everything, then you can apply. And then again, we will review all your requirement and then give you the final decision.
Okay.
Does that answer your question?
Yes. Okay. Thank you so much.
You're welcome. Does anyone have any other question? I'm about to put
Hi,
the link. Yes. Hi.
my name is Nadia. I'm a nurse. I have like 4 years of experience in Canada. I did HCA, but my what I'm trying to ask, I renewed my permit. It's expiring in August. Am I allowed to register or no?
Your work permit is expiring in August, right?
Yes.
But are you in the process of renewing it?
Yes.
Okay, so if you're applying for the French cohort, the upcoming one, unfortunately, you will not be eligible for that at the moment. But if you're applied for the English or the second upcoming French cohort, which will be in September, the English cohort, then by then you will probably have renewed or at least received an email of confirmation for your renewed work permit.
Okay, and I have another question.
Yes.
In 2024, I did my CLB and I scored 6. Am I supposed to go back and do it again?
No, you're not supposed to do it again.
Yeah.
You don't have to. Yeah. So if you don't mind me asking, are you a French speaker or English speaker?
I'm an English speaker.
Okay. So that depends on, have you taken any other classes after that?
Yes, I did HCA healthcare aid course.
Yes. So if you take any English classes or any classes that provide English communication or English like upskills in general, you can provide the certificate of that classes that you took as well.
Okay. Thank you so much.
You're welcome.
Yes.
So for the English, it depends. So some people, for example, might have did their exam 1 or 2 years ago, but they went into a school or into a program or into a language program. So if that language program can provide that you have the set of a skill or you have the level that is required, that is okay. You don't have to redo the test all over again. Okay. Does anyone have any other question? Feel free to raise your hand.
Yes.
Are there any other programs that supported applicants or candidates with less experience? For example, I'm a recent graduate medical student, and I don't have more than 1 year experience. It's the internship year, yeah. So, is there other options, or it's the only option that you should have 2 years of experience?
No, it's not. It's not. Our program is not the only option. There is other programs that can take you with 1 year of experience. So I can just provide my email and feel free to send me, and I will send you those programs.
Okay, sounds good. Thank you so much.
You're welcome.
Hello,
Yes.
I'm a nurse in anesthesia and intensive care, and I'm a French speaker. I don't have experience in my country, and I want to be a nurse, a registered nurse here. Is it possible without experience?
You don't have any experience at all.
Yeah.
So at the moment for our program, you will not be eligible for the program, but with your background for nurse, one of the programs that I will highly recommend to get in contact with will be the Care for Nurses organization.
Okay.
Okay. So feel free to email me and I can send you the resources if you want.
Okay. Thank you.
You're welcome. I think Barbara has her hands up.
Hello, thank you, Kidis. Hi, Kidis. Yes, this is Bob, your colleague. Yes, I need you to clarify with this work permit thing, because some of my clients, they have the work permit, but they're not falling into the category of a refugee claimer. So they are like, I suppose, sponsorship, waiting for the PR, or, students, suppose, with a work permit. So it's not in the, refugee claimant category. So is that open to them?
No, only refugee claimant with work permit or conventional refugee with work permit. Yes.
So the other candidates, they have to wait until they sort out the PR.
Yeah, they have some sort of an immigration status like refugee, conventional or PR.
Yeah. Okay. Thank you.
You're welcome. Thank you. Melody, you have your hands up. Hi, Melody. Can you hear me? Okay.
Okay. Yeah.
Yes.
I didn't really get the full details of the program earlier, so I just wanted to know if child care is part of the program you guys are talking about, because I'm interested in that. I have no experience on that anyway, but back home in my country, I teach children. So I don't know if you guys have any program that can sharpen my experience here in Canada. That maybe I can.
Your background is teaching, education and teaching?
Yes, education and teaching. Yeah.
Okay, so this program specifically is people with this health professional background, like nurses, pharmacists, and etc. However, with your education, feel free to contact me and I can send you some resources you can reach out to.
Okay. So you're going to drop your email address?
Yes, it's in the chat. My email address, my contact number, and the link to apply for the program. It's all in the chat. If you cannot see it, I can resend it again. Okay. Fanette?
Yes, madam. Good morning.
Good morning.
Yes. I am a technician medical laboratory. I will do the activity retail 3 weeks to work scale. I do it. Now my PhD is 3. Why can I do it, please? I am doing the English now.
You are doing the English at the moment?
Yes.
So unfortunately with the CLB3, it's very low. However, if you are already doing your English classes, so you can reach out to us because we're going to have another French cohort probably in October. So you can reach out to us if you reach that level before October. And then you can be considered for that cohort.
Okay.
Okay.
Thank you.
Welcome. And then Lydia.
Hi, Kiden.
Yes, hi.
I wrote my IELTS in 2024. Do I need to, and I've not taken any English class, I'm an English speaker. Do I need to rewrite it before I join the second cohort?
Does your level make you qualified for the program? Does it IELTS 6 and above?
Yes.
Yes, you don't have to write it again. So for the English, even if you did it 2 years for the IELTS or it's just expiring or about to expire, it's okay. We accept those.
All right, thank you.
You're welcome. Favor or favor? Favor. Okay. Lydia, do you still have a question?
No.
Okay, thank you. Okay, if anyone
Okay,
has any
hello.
other question, yes. Hi, Favor.
Hello. Yeah. Good morning, ma'am. Okay. I thought maybe it's a program that someone can be able to divert health related because back home, I read accounting, so I was thinking that maybe it's a program that one can be able to switch to health related this thing. So I thought.
Yeah, I totally understand. Unfortunately, with our program, there are some other programs that you can help you do that change, basically school programs to be more accurate, but our program with people already with the education and the experience.
Okay.
Thank you. Okay. Any other question?
If I have a question, regarding the English test. If I have a CLB from 3 years, it working or no?
The CLB from 3 years?
Yes.
If you want to redo it, it's okay, especially if the scores are not meeting up the scores at the moment. If you would like to repeat it, then that's fine.
Okay.
Yes. Okay. Does anyone else have any other question? Okay.
Hi.
Hi, Sarah. We have Sarah and Patty. Okay, Patty, go first.
Oh, thank you.
You're welcome.
May I ask her when the application deadline for the English cohort is?
The English cohort is going to be in September.
Oh, okay. So
Yes.
also, when is the course and the training officially begin?
So, for example, we have the English and the French. For the French pathway, this is open to people who are originally Francophone bilingual, and that will start in June 15th. For people who are only Anglophone or English speaker, that will be in September. The training itself will start in September. However, you are open to apply now.
Okay, thank you.
You're welcome. Sarah.
Good morning.
Good morning.
Thank you for the information. I have a question. I am a French speaker, but I didn't do the test, the YMCA test language. Do I have to write it again? Going and ask.
Do you have any other English tests?
I do have English test and I have a certificate. I was going to do the training in French. Is it possible that I can go and write the French test now?
So even for the French pathway, you will need an English assessment.
Oh.
So basically for the French pathway, you will need an English assessment, whether that be CLB, whether that be a school you're having classes, whether that be IELTS or any other thing that can be equivalent, it has to be level of 5. Okay. And for the French, you will have to prove like education in French, for example, as a proof of your French. Like your education certificate has to be in French.
Okay.
Yes. If you don't have the English assessment at the moment, we can refer you to do the English assessment.
I do have English, but don't have French.
No, you don't, but you have your education was in French, right?
Yeah.
Yeah, that's
back home was
yes,
French.
that's sufficient at the moment.
Okay, thank you.
You're welcome.
Hello.
Yes, hi. I have someone called Zoom user and someone iPhone.
Hello.
Yes, I can hear you.
I'm back again. I have another question.
Mm-hmm.
Can I still register as I wait for my work permit to get renewed?
Yes, you can register at the moment. Yes.
And how can I do it?
So in the chat, if you can see the chat, you will find my contact, and then you will find a link. You can apply to that link.
Okay, thank you so much.
You're welcome. So someone, the name shows Zoom user, you have your hands up. I'm not sure if you still have a question. Okay. I hope the information was sufficient, and hopefully I was able to answer all your question in a sufficient way. And this, yes.
I have another question. Like back in our countries, like here when you say RPN for us it's for 2 years and diploma is for like 4 years, like RPN. Do you have like the specific answers you want, or you want diploma, certificate, or bachelor's?
Usually we take bachelor's. Okay, but if you have a 2 to 3 diploma, then we can just take a look into your experience, your resume, because at the end of the day, it's a collective of everything you have and everything you have done, right? So the general rule is bachelor, but if you are someone that have a diploma, you can apply, and then we can see at the collective of all the information and skills that you have, addition to what are your target or what is your goals that you're trying to achieve.
Okay, thank you.
You're welcome. Fauzia.
Yes. Please, can you hear me?
Yes, I can hear you.
Yeah, so I joined the session a bit late, so I don't have your contact and the link you are talking about. I can't find it in the chat, so I would be glad if you'll be able to put it back so that I can.
Yes, I just did. Are you able to see it now?
Yes.
Yes, okay.
All right, thank you.
You're welcome. Patty.
The last question, I want to make sure from the definition, client must be international, educated, healthcare professional. Which profession are included in the category?
Okay. So the profession that we accept are anyone that nurses, pharmacists, physician, family physician, medical laboratories, what else? And then people, for example, who has a bachelor in science with a master in public health, for example, with experience in public health, for example. We also accept biotechnology, people with a biotechnology background, education, or master or experience.
Okay, so you will review all the.
Yes.
Yeah. Okay.
Yes. So that's the thing. When someone applies to the program, we review all the information, because basically we require you to submit a proof of education, proof of address, proof of English assessment, and all those. So I go through everything, including your resume, and then review everything. And then based on that, the decision is made.
Okay, thank you.
You're welcome. Okay. Any other question? Okay. Good. So if anyone can see the chat, I put the link to apply to the program along with my contact information. Feel free, if you are aiming to apply for the program, it's better to use the link. Just use the link and apply, and then I'm going to reach out. If you have a question, or if you're one of the people that I told you that I can provide you a resource of sort, feel free to reach out to my email directly. Fauzia, you have your hand up. Do you have another question?
Oh, yeah, I think you just answered that, because I wanted to ask, I have other questions and I would want to talk to you personally.
Yes. So if you have a question, or you have a doubt about something, or you feel like you have any special case, feel free to reach out to me through the email directly. If you're interested in applying for the program, at the moment, it's better to apply through the form. Yeah. Okay. Either way, I will receive the information. Okay. So thank you everyone who has been here, and thank you for your time and your patience. And if you reach out, please realize that at the moment we're having a bit of a wait list, so it might take a time for us to reply back, for me to reply back, or for us to reach out. But if you send an email, it's there, and sooner or later we're gonna reach out. So thank you everyone for your time, and hope you have a wonderful day. The weather is not so bad today, so hope everyone goes out, enjoy the weather. Well, this is Canada, everything revolves around weather. We all know that. So I hope everyone enjoyed the rest of the day, and thank you so much.
Thank you so much.
Thank you so much.
Thank you
so much. Thank you.
Thank you so much for your time.
Bye.
Have a great one, everyone.